Well, I'm pleased to provide some advice about the government's actions in relation to the monkeypox outbreak, which has been spreading through 76 countries so far, outside of those that have had endemic monkeypox for many years, for the last 13 weeks or so. I was first briefed by the Chief Medical Officer on the monkeypox outbreak on the 20th of May, the day before the federal election, which was the day after the first case was notified here in Australia on the 19th of May. That was only 2 weeks after the first case had been notified outside of Africa in the United Kingdom. And in those 13 weeks, the CDC in the US reports that there are more than 25,000 cases now in 76 countries outside of the endemic areas of Africa, including 58 cases which have been reported here in Australia. On that same day, the 20th of May, the government, which was then the former government, then the Albanese government, started negotiations with Bavarian Nordic. We've had 27 meetings with that company since then to secure supplies of their third generation vaccine, which is a vaccine that can obviously prevent the transmission of monkeypox virus, but also be used as a post-exposure treatment. And I'm pleased to announce that this week we have secured an agreement for the supply of 450,000 doses of that third generation vaccine, 22,000 of which will be arriving in Australia this week and next week. The remainder of 100,000 over the course of the rest of this year, and 350,000 doses into 2023. This vaccine is far more effective and certainly more user-friendly for patients which may have compromised immunity, and the Chief Medical Officer will go into this, I'm sure, than the second generation vaccine, which has been in the National Medical Stockpile for some time, essentially a treatment for smallpox, which can also be used against monkeypox as well. So the first element of the government's actions against monkeypox is to procure the world's best vaccines for Australians, and we are now one of only a very limited number of countries that have been able to secure supplies of this highly contested market of this third generation vaccine in 2022. We will be rolling out that vaccine through state and territory largely sexual health clinics, but the Chief Medical Officer can talk more about that. And we've been in discussions with state and territory governments now for some weeks about those arrangements, and we're confident that they will start to be put in place very, very quickly. ATAGI, the Technical Advisory Group on Immunisation, has very clearly spelled out those cohorts, those at-risk cohorts, which will be the priority group for those vaccines. So I'm very pleased that we've been able to secure those supplies, one of the very few countries in the world that have been able to do that. The second element of our three-point plan is to increase clinical capability in this area so that doctors and other clinicians are able to identify, isolate and then treat cases as well as contacts as quickly as possible. We've been rolling out communications to clinicians now for several weeks, but we'll now be able to engage in training and further information for clinicians around these new vaccines. And the third element, the very important element, is community engagement. And we've been working closely over the last several weeks with the peak advisory bodies in bloodborne viruses and STIs, particularly the Federation of AIDS Organisations, the clinicians in ASHM, NAPWA, the Association of People Living with HIV and AIDS, and others. And we'll be engaging particularly AFAO, the Federation of AIDS Organisations, and ASHM to leverage their networks and their capability that they've built up over the last 4 decades to make sure there's really good engagement and good information into those at-risk populations. So I'm very pleased with the work that the CMO and the department have been able to do in a very short period of time, particularly to secure those supplies of vaccines which are so highly contested in a constrained global market.